Welcome to AgeWise Health. I'm your host, Maggie Jess, Director of Nursing at AmeriStaff Nursing Services. Today on our show, Getting Back into the Community, I have Lexi Brady, Marketing Director of Admissions at Communicare. Hi, Lexi.
Hi, thanks for having me.
Oh, thank you for joining us.
Of course.
So, Lexi, tell me a little bit about yourself and then how you came to be at Communicare.
Okay, so I graduated from Central Michigan University back in 2019, so like right before COVID hit.
Oh, yeah.
It was in integrative public relations. I was having trouble finding a job right then, so I ended up working at an eye doctor. Never thought I'd be in the medical field at all, but loved that. But then realized after COVID, I was like, all right, I really want to use my degree, get into something. I found Communicare on Indeed, and the rest is history. I've been here for almost 3 years now and still in the medical field. Didn't think I would be, but yeah, it's been great.
Yeah, the medical field is definitely different.
It is very different.
That's a great way of putting it, right?
Yeah.
So for those watching, what is Communicare and how did it get started?
So Communicare Michigan is a TBI rehab company. It started in Florida back in 1989 by 4 professionals in the industry. But they noticed that there was a real need in Michigan, and then in 2009 they met Dr. Kelly up here, and we just started up here. We eventually closed our Florida location just to really focus on Michigan, and that's how we have our Troy, Utica, and now Grand Rapids locations. But we are looking to go back to Florida, so that's also going to be opening up soon too.
Oh, that would be great.
Yeah.
All right, cool. So you service kind of all of Michigan right now?
Yep.
Okay.
Yep, Troy, Utica, and Grand Rapids.
Okay. What type of services do you guys specifically provide?
So we offer semi-independent living, we offer day programs, and we also offer all of the outpatient therapies. So PT, OT, rec, mental health, speech, we've got it all.
Okay. And then do you offer it at a standalone facility? Can these patients go to an outpatient facility? How does that work?
Yep, so each of our locations, we have a day program built into it with the therapies.
Okay.
But as far as like the housing goes, we can look within 20 minutes of any of our locations in order to get them like an apartment, a house, condo, anything like that.
Okay.
We fully furnish, we cover the rent, we do all of that.
Okay. And are these specific to each patient, obviously, because everybody's different?
Yes.
Okay.
So like if, one of our clients has like a kid or something, like we try to accommodate in like with spaces and yards if they have animals, stuff like that.
Right. I didn't even think about that, to have like animals and other family members.
We have some that have kids that either live with them full time or they come and visit on the weekends or whatever. Yeah.
Okay. So service area then would be between the Troy, Utica, and Grand Rapids areas, 20 minutes out.
Yes.
Okay.
That's a safety thing. Like we have to be able to get to them in case of emergency.
Okay. Can they still use some of your services if they live farther away, if they don't use your housing?
Yes. Yep.
Okay.
Yep. We can still do the outpatient therapies. Day program, we can even do like a work from home type thing.
Okay.
So we're really flexible with it.
Oh, wow. Did you start work from home with COVID, or has it always kind of been like that?
I think that started with COVID. I wasn't here during COVID, but I know now that we're able to be a little more flexible since technology is great, so, yep.
That's really cool.
Yeah.
So you had mentioned TBI patients and auto. Is that your primary focus? Is that your case mix index that you guys use?
Yes, because the auto insurance is what pays for like the day programs, the housing, all of that.
Okay.
Now with mental health therapy, we can take commercial insurances.
Okay.
So that's kind of opened up to like everyone, pretty much.
Oh, that's wonderful. So you don't have to be an auto case or a TBI case?
No.
Okay,
Nope.
so you do take some commercial insurances then.
We do.
Okay. So that kind of was going into my next question about cost.
Yeah.
So is there a cost to the patient or the family?
No.
No cost.
Nope.
Wow.
So what we do is when we get a referral in, we have our biller check with the adjuster, make sure everything's good. Once we get the all clear, we're good to go.
Okay.
Yeah, zero
All right.
cost. We cover everything.
Okay. So you'd mentioned mental health. What other special programs or day programs or educational trainings, anything like that, do you guys offer to your TBI patients?
Yep. So our day programs are each a little bit different. So I like to say they have like different personalities at the different locations. So like Utica is like a log cabin in like a neighborhood. It's huge. Cool. There's a wood shop. We've got laser engravers, 3D printers. It's very like hands-on there. At Troy, it's kind of like the arts and the crafts and the stuff like that.
Okay.
And then Grand Rapids kind of has it all as well. And the cool thing about Grand Rapids is the front part is actually a boutique. It's the Care Boutique. The back part is day program. So our members can help work the boutique, and we also sell things that our members make at the boutique.
Oh, cool.
So it's a really cool setup over there.
That is awesome. Okay. Now, with Michigan being a no-fault state and auto laws changing like they have, I know we do home care at AmeriStaff Nursing Services, so we have, and we always have been, but an accreditation.
Yes.
Do you guys have an accreditation that you have to follow?
Yes, so we are CARF accredited, 3 years. We just got it back in February, actually. So we just started our next 3 years.
That is no small feat,
No,
accreditation.
that was a fun few days.
Yeah. Any other special certifications that you guys hold at this time?
Not that I'm aware of. That's
Okay.
like the big one.
Okay. And then, do you guys give back to the community at all? Is there any certain programs you do that are outside of the norm of, like you said, your day programs, the boutique and the wood shop and things like that?
Yeah, so like our day programs, we always like to give back to the community, and we get our members involved in that as well. So like for the winter months, we've made blankets for the homeless shelters and the kids' hospitals. We've volunteered at, the animal shelters.
Oh, great.
And we even like make them treats, like homemade treats, and drop them off.
Okay.
Our occupational therapists can also help our clients like get out into the community and find things that they're specifically like looking for.
All right, so it's very specific then.
Very specific, yep.
That's wonderful. And it's personalized, so
Yes.
they feel they have a relationship with said occupational therapist.
Yes,
Like that.
very person-centered care, yep.
Okay.
And we're a little bit smaller, so we're able to have those like more meaningful relationships with the clients.
Okay. Would your therapists, nurses, case managers go out and see patients at their home?
Yes, so that's primarily for the ones that live with us.
Okay.
Because they're inside that 20-minute radius.
Correct,
Our
okay.
therapists are allowed to be a little bit more like flexible with time, and
Okay.
yeah, we do like the home evals and all that kind of
I know
stuff.
that. Okay, so if it's outside of your 20-minute radius, you could possibly use someone like AmeriStaff Nursing
Yes.
Services that would go out.
Correct.
And we would work together essentially.
Correct,
Just so people know who to contact and you know,
Yeah.
where they are located is, could be an issue. I mean,
Yep.
upon discharge from a hospital, you're seeking care and you just, some people don't know where to start.
Right.
Okay.
And sometimes it's hard to find like a place within the 20 minutes, especially like if they have family members or whatever, it's hard for them to get there if they don't have a car. So we try to be as like flexible as we can.
And transportation could also be an issue. Do you guys assist with that at all?
We do. So if they're in our residential or day programs, we will transport to and from.
Okay.
And then also we do doctor's appointments as well.
Okay, that
So,
was going to
yep.
be my next question. Okay. And I mentioned earlier about accreditation and things like that and auto law changes. We all know that the auto law changed. How has that affected Communicare's business model, or has it at all?
So it actually has not.
Okay.
So even during, all the changes, we were still able to fully run programming. We were still able to transport. We were still able to do the grocery cards and, furnish the apartments and stuff like that. Because we offer so many different programs all under one umbrella, we were able to, be successful during all this time and not really have any issues.
That's wonderful. You guys have figured it out.
We figured out we've got a great biller.
Good employees.
That's right.
That's wonderful.
Yeah.
That's a sign of a good company. You can still stick around even when things aren't perfect.
Yep.
And do right by the patient.
That's right. Yep.
Like-minded people. That's wonderful.
Yep.
So without violating any type of HIPAA,
Yep.
because we would not do that, give me one wonderful, positive story that stuck with you in your time that you've been with Communicare.
So we had a gentleman that was that came to us for some outpatient therapies. Kind of just briefly, his backstory: he was in an accident, was in a coma for 3 months.
Okay.
So, not great at all. But he ended up coming to us, and he is now completely rehabilitated, no real deficits, and he went back to his billion-dollar company with no issues. So rehab really does work.
That is wonderful.
Yeah.
And that one-on-one care really does work.
It really does.
When you pay attention to what's going on.
Mm-hmm. Sure
That's
does.
wonderful.
Yeah.
Lexi, thank you so much for being on our show
Of
today.
course. Thanks for having me.
This is
It's
some
been
great
great.
information.
Yeah.
That concludes our show today, Getting Back into the Community. Thank you to Lexi Brady at Communicare Michigan for being our guest today. If anybody has any questions about anything we talked about today or home care, please call us at 248-288-2270. Stay safe and healthy.